1922. As you can see, I'm in my 92nd year. In that time, I've had 9 hospital experiences, and I'm here today because of the care and expertise of the medical staffs. And I was told to keep it short, so I'm going to put the cat among the pigeons because I'm going to talk about cleanliness, nutrition, and common sense. It was a lack of common sense when the decision was made to outsource these services. One of my earliest recollections is Mother saying, "Wash your hands before coming to the table or after going to the bathroom." All rules for good health. Now I'll give you 3 bad examples. When visiting a friend at the hospital, I had to wait until the doctor left. I became aware of a strong smell of disinfectant as the cleaner passed by. I looked in the bucket. The water was dirty. Now, any housewife knows the effectiveness of the disinfectant and cleaning is greatly reduced when the water is dirty. On an unplanned visit to emergency, I became aware of a large splotch of blood on the drapes. It was over 2 hours before the clean drapes were put up. In the 12 hours I was there, the floor was not washed. Now, oh, brother. I hate this thing. My impression was that scrubs replaced uniforms. They should replace street clothes at work and should never be worn outside the hospital. Not on coffee breaks, not in Starbucks or anywhere else. Now I'm going to preach to the already converted. In the 1860s, John Lister knew all about infections and deaths caused by poor health standards. Why are we, after 150 years, regressing? Now about nutrition. Mother said, eat your vegetables and you'll grow big and strong. Well, 50% isn't bad. As you can see, these vegetables were properly cooked. On one of my hospital stays, I had no food for 5 days. I was looking forward to a full meal. The tray was put at the foot of my bed, and I was too weak to reach it. It resulted in 2 things. The meal was cold by the time I'd got it, because I'd had to call a nurse, which is doubling up on personnel, not cost effective. Put food preparation back in the hospitals. Then you can control the quality. At present, hospital food is inedible. If mistakes are made, they can easily be rectified, and the food isn't frozen and reheated. Which meal would you rather have? When you're ill, your appetite needs to be stimulated, and the food should look good enough to eat, not like the dog's breakfast. Let the dietitians do what they're trained for. If the kitchens are in the hospital under hospital administration, dietitians can ensure that patients receive correct diets. And apparently they also believe in that old adage, an apple a day keeps the doctor away. Some of my friends bring food in for their relatives, and recently I had a friend who spent 5 days in ICU after a heart attack. She was on a salt-free diet and was promised chicken broth. And guess what? It was salty. Our medical caregivers have their hands tied. The 2 support services necessary to maintain good health are no longer in their control. See, I knew I'd mess up. Go away. This is crazy. Maybe it's incipient Alzheimer's. Put the cleaning and food preparation back in the hospitals under hospital administration. Make these services part of the team, and as part of the team, they will have the commitment to doing the best job possible. Again, I'm preaching to the converted. Staph aureus is by far the greatest problem in Canadian hospitals, and it tends to be drug resistant when caught in hospitals. Common sense says that prevention is the answer. Clean up the hospitals. I'm going to go and do it without. It's all dollars and cents. Outsource the cleaning and food preparation, and you have 2 fixed costs. This is unacceptable if it jeopardizes life. If one person dies of Staph aureus, it's one too many. Is it cost-effective spending millions to build state-of-the-art facilities, only have to close them because of staph? Healthcare, universal healthcare, that's out of place, but that doesn't matter, is a beautiful concept. But the implementation in reality is just short of disastrous. Basic support services should be administered by the hospitals, not the health system. Does the health system ever think of consequences? Put the food preparation and put cleaning and food preparation back where it belongs. Well, I'm going to skip my experience. I was in the hospital when I was 10. To the health system, I say, read the Hippocratic Oath. First, do no harm. To me, medicine has always been on a pedestal. 9 times I've been in the hospital, and 9 times I've been saved. Every Canadian citizen is entitled to excellent health care. A grain of sand in an oyster produces a pearl. My hope is that I'm the irritant that starts the process toward the excellent health care. Help me make the health system accountable. And thank you for your patience.